Hello! Welcome!
Good morning! Ang ating bisita for today ay si Doc Margaret Joyce Cristi-Limson. Good morning.
Hi, Doc.
Ayan ang aming barkada. Good morning. Kain kayo.
Kain kayo mamaya.
Tayo ay magdi-discuss muna. Upo ka dito, Doc. Diyan. Si Doc, meron akong gustong itanong sa inyo eh. Pero bago lang yan, oy guys si Doc ay isang OB-GYN ng St. Luke's Medical Center, Semi-Global City. Hi po.
Hi, good morning.
So ngayon po ang ating i-discuss ay about natural family planning, NFP.
Yes.
Ano po ba ang natural family planning?
Well, it's also known as fertility awareness. No? It's being aware of when or kailan yung fertile time so that it can work both ways. It is one is to prevent getting pregnant, or number two, it is actually knowing when you can get pregnant. So if you want to get pregnant, then that's when you would actually try more.
Does it also pertains yung natural family planning yung gender ng isang bata? Not necessarily.
No. Unfortunately, walang scientific way or proven way to actually
determine the gender of the baby.
or timing-based, no? To be able
necessary.
to produce a baby of the desired sex.
So ngayon, ma'am, ang gusto ko rin po malaman, ano-ano po ba yung mga methods ng family planning?
Well, there are actually a few. So one is the calendar method. So you will have to be aware of your cycles or how long your cycles are, no? Then if you have a rough estimate, no, for 6 months, let's say you get your menses every 28 to 32 days, then you subtract 18 from the shortest cycle and subtract 11 from the longest cycle, and the time in between will be the time that you are probably most fertile. So let's say it's a 26-day cycle, no? 26 to, let's say, 34. So 26 minus 18, ilan ba yun?
Oh. Pero yun ba yung sinasabi din nila, Doc, na 3 days before and 3 days after? Na,
After what?
Na you are safe naman kung 3 days before and 3 days after your regular menstruation cycle.
Well, it depends if your cycles are quite regular.
Oo.
Yes.
So yung itong specific method na
Calendar
po to,
method.
calendar method, is only applies dun sa regular ang cycle, menstruation cycle.
Most of them will apply to those with regular cycles. So that's one way, no, the calendar method. The second would be withdrawal. So of course, no, coitus interruptus. So when the husband is about to ejaculate, so he withdraws from the vagina of the woman. Okay. So other methods will include, if your cycles fall between 26 to 32 days, then you can just abstain day 8 to day 19.
Day 8 to day 19.
So that's actually quite easy for some women to remember. If they remember.
Oo nga eh. So most probably, ang pinaka-tip dyan, Doc, is talagang sa calendar, i-mark na nila.
Yes,
Para to
pwede
make
yan.
sure hindi sila malilito.
Yes. Actually, there are some paraphernalia, like there are beads, fertility beads or ovulation beads. So, minamark nila, tapos umuurong sila every day. And then they will be reminded day 9 to day 18 na hindi sila dapat nag-intercourse during that time. And then there's also the cervical mucus method, no? So if you're aware of your body and the woman produces a certain type of egg white type, cervical mucus, then she's most fertile during that time. So maybe about...
Yan ba yung tinatawag nilang supposedly white menstruation?
It's actually not white menstruation. It's supposed to be yung
Eggish eh.
egg white. Oo nga, ganun. So it's sticky. So 2 days after you're dry, safe na yung lady from getting pregnant. And then there's also the basal body temperature. You'll have to have this temperature that's very gradiated in Fahrenheit because imo-monitor mo yan every morning before you actually get up from bed. So once you wake up, you take your temperature, then you plot it in this chart. And if you notice na medyo magdi-dip siya right before you ovulate, then it increases just slightly, consistently, then you're fertile during the time.
Ano po ba ang temperature supposedly? Yung number?
Well,
Para malaman mo
we
na...
don't usually use this anymore, no? But it has to be, it's not really this absolute value. It's a change from your baseline. So it will dip a bit and then it will increase by about 0.4 to 1 degree Fahrenheit consistently for about 3 days. And on the 4th day after that slight increase, then the woman is not fertile anymore.
Ano-ano pa po? Meron pa po ba tayong
There's one last,
One
no?
last,
It's a combination of
everything that you've said?
well, yeah, then no, of the women, what women feel. Okay, one will be that will be a combination of the temperature, the cervical mucus, and changes in the texture or the feeling of the cervix. So that's what we call the symptothermal. In theory, amongst all these methods, that would be the most effective. But you'll have to be very aware of your body.
So, tanong ko ma'am, no, sa lahat po among those methods na na-mention yun, na-discuss natin one by one, ano po yung pinaka, you think, di ba, parang mas okay, reliable?
Well, it will only be reliable if you have regular menses, okay? And if the couple is very motivated.
Yes.
Okay, otherwise, alam mo hindi ka dapat nag-intercourse during this time period, tapos magsisex kasi hindi maiwasan, then there's always this chance of getting pregnant. Okay? But amongst them, no, like I said, it's about 98% effective, both for the consistent use and for typical use. That's for the symptothermal. For others, if you use it very correctly, it should be about 95 to 99% effective. But with common usage, like withdrawal, no, the typical use, the failure rates can go up to as high as 25%.
Pero may big impact din ba ang age ng isang couple when it comes to family planning, yung natural family planning?
The age of the woman is actually the most significant factor in terms of fertility. So, in terms of
Can you say, ma'am, doc, na the older the woman gets, the higher risk of getting pregnant or lower
it's
risk
the other
of
way
getting
around,
pregnant?
okay? An older woman is less
Lower,
likely to get pregnant. It's just because when the woman ages, when she hits 35, the quality of the eggs declines significantly as well as the quantity. So let's say...
So age talaga is a big factor.
the woman's age, no? As opposed to the man's age.
Wala.
Hindi siya
Parang
masyadong...
sa lalaki nga, di ba sabi nila at 40, mas okay pa sila eh. Life begins at 40.
Ganon.
Depende sa lifestyle din, ano? Oo.
So, a woman who's 40 years old or even a woman who's 38 years old versus a woman who's about 25, 28 years old, mas fertile ang 25 to 28-year-old woman, no? As opposed to a 40-year-old woman.
Okay. Now let's talk about the celebration of natural family planning method. Can you walk us through the celebration?
What do you mean the celebration?
I mean, I think you have a celebration about effectiveness of natural family planning.
I'm not so aware of that.
Okay. So, how effective naman po ang family planning sa isang family?
Well, consistent use, no? Like I said, about 98 to 99% effective if you use it correctly. Like I said, a highly motivated couple. But for typical use, minsan hindi nasusunod. As much as a 25% failure rate. So you can get pregnant too.
So before I close this interview, Mama, no, doon sa nabanggit natin when it comes dun sa age, paano naman po pagbata?
It's the same
Same.
apply, yes. But of course, for a younger woman who's not in a relationship, may have to consider other methods, barrier, who have other sexual partners. Yes, because of course, natural family planning will not prevent the transmission of sexually transmitted infections.
Okay, alright. Maraming salamat. Any other misconceptions about natural family planning, Doc?
Well, it is an effective, I just want to emphasize, it's not less effective than the artificial ones, as long as it is done correctly, okay? So if a couple is taught how to use it well or properly, then I think it should
There would be no
effective.
problem at
And
all.
of course, in terms of religion, it is the more acceptable
Yes. Birth control.
birth control method.
Now, for those who want to ask you, Doc, no, with regards to fertility and everything po, where can they contact you?
Well, I hold clinic in Makati Med, St. Luke's, and in Philippine General Hospital and Medical Center, Manila. So
Alright.
they can just look me up in the directory.
Okay. Maraming salamat po
Thank
sa
you.
inyo, Doc.
Alright.
Diba? Doc Margaret Joyce Cristi-Limson, Ob-Gyne ng St. Luke's Medical Center, Global City. And
Thanks as well.
we hope to see you more often here in clinic in bahay ni Kuya.
Alright. I'll watch your show.
Ayan, thank you.
Alright,
Thank you very
thanks.
much. Guys,